Medication safety and coordination matter. Joining us are Dr. Parminder Shahal and pharmacist Stanislav Sazonov from Medisol Pharmacy to break down how teamwork between doctors and pharmacists can prevent dangerous mix-ups and improve patient outcomes. Welcome.
Thank you for having us.
I'm so glad you're here. You know I love a compounding pharmacy, and Medisol is both. You do commercial prescriptions, you compound. I take your multivitamins that you gave me last time. Now I've got hair, skin, and nails. That's all fun. But the serious business is medication errors are pretty common because we all have multiple providers. What are some of the errors that you most commonly see?
Yeah, so we see duplicate therapies. For example, patients will get lisinopril and losartan, ACEs and ARBs, cannot be combined together. Sometimes you'll see an antibiotic and another medication combined together, like Bactrim and warfarin, a blood thinner. Both common medications, but interact severely. Another one would be ciprofloxacin tizanidine, again, a muscle relaxant antibiotic. Both very common, but they are contraindicated. You can never be on the same medications at the same time. So that's where catching those medications errors and addressing them in real time is very important. And having a pharmacy that can do that efficiently, again, is super important.
And look, no smoke to the big box pharmacies that we all know and love, but they might not have the time to look at a patient's complete list of medications and see, you know, that these two things don't mix. You're in internal medicine.
Internal medicine, yeah.
Right. And so a patient might be seeing you and then also multiple specialists.
Yeah, you know, that's not uncommon. Certain patients, they have seen some other providers and they come to my practice, my clinic, see, and they don't know, they are not always communicating with me. They may say they put me on some other medication, but not always able to figure out which one it is. So if they go to pharmacy to fill the medication which interacts with the ones that they're already on, that will be the right time to catch that. And that can be caught, but then the critical part is communication. Like, okay, so we caught it, this may have potential interaction, but then what? So then one option would be send a fax, e-fax to the doctor's office. That may take another day and then be looked by the staff, and then third day, or it's the weekend. However, if that can be communicated, you know, within a few hours, say, and my office staff, if they're called, they usually, you know, put me through if it's a pharmacist. But I'm telling you, with the time, you know, with the commercial pharmacies, they may not always have time. Plus, they have systems in place where they just have to send e-messaging, e-fax. So that is where it's critical to have to work with a local pharmacist if they are available. Right, Stan is now available, so I'm like.
Stan will pick up your call.
He does, yeah, actually.
Yes, absolutely. We work together very well. Anytime Dr. Chahal has a question, he can reach out to us. We also have a great app where patients can access us, and instead of calling us, they can send us a message. So can you imagine not calling your pharmacy, but sending a message for a simple question? Hey, why is my pill blue and not green like it was last month? Or do I take my medication in the morning or at night? So being able to get a hold of a pharmacist is essential.
Especially with what we're talking about, if you're not sure if two of your medications are interacting, shouldn't be interacting, if the dosage is correct, you don't want to wait 3 days, especially because even if a medication interaction isn't dangerous, it might mean that your medication just isn't effective.
That's true. So I'm not saying that they don't communicate, the other pharmacies, but there's a system. So it has to go through the e-fax. Those things take time. If things cannot wait, you know, if a local pharmacist is willing, like available, like he is, they can communicate faster. So we can catch the things
beforehand. So you
beforehand.
have the app now, Medisol Pharmacy. You are out in Glendale. If people want to try compounding pharmacy, what's the best way to get in touch with you?
So we have a website, medisolpharmacy.com. We're right on the border of 67th and Peoria, so border of Glendale and Peoria, so actually serve both areas very well, close to Sun City. Calling us, texting us, you can go to our website and even message us through our website. We have a head that you can click and send us direct a message to the pharmacy. So very easy, very accessible, and we have an app, obviously, that you can use to get a hold of us. One last thing I want to leave your viewers with is if you ever have any medication questions, don't wait to go home and take them unsure of how to do so. Make sure that you always ask your pharmacist. Doesn't matter where you feel. That's our job. That's our responsibility. We want to make sure that you're safe. Doesn't matter where you feel, whether you feel with us or any other pharmacy. If you're not sure about your medication, to prevent those errors, please come and talk to a pharmacist.
Thank you so much, doctors. It's been a pleasure to talk with you. And if you want more information, of course, we will post that on our website, cw7az.com. Thanks again.